So, with the current high levels of vaccination and the high levels of population immunity from both vaccination and infections, the risk of medically significant disease, hospitalization, and death from COVID-19 has been greatly reduced for most people. And at the same time, we know that some people in communities, such as our oldest citizens, people who are immunocompromised, people with disabilities, they're going to be at higher risk for serious illness, and they're going to face challenging decisions navigating a world with COVID-19. And that's where the data and the science comes in to help ensure that we can protect them in the best way possible. And so given this, CDC recently updated the way we monitor COVID-19's impact on our communities, including focusing on three primary factors, which are shown here. And that's protecting the most vulnerable, preventing severe illness, and minimizing burden on the healthcare system. And again, that's because we have evolved into the next phase of the pandemic, reinforcing the importance of focusing on these key indicators of severity to best protect public health. And we know that while we can't prevent all cases of COVID-19, we can certainly continue to limit the spread and protect those who are going to be most at risk of severe illness as we enter this phase of the pandemic. Now health officials and individuals should consider these factors when making decisions about community prevention strategies and individual behaviors. And that's important that we use the data to inform the recommendations we make, both at the individual level, but also at the community level. And so use of these COVID-19 community levels ultimately helps communities and individuals make those informed decisions. And it's going to be based on their local context and their unique needs. And so community vaccination coverage and other local information like early alerts from surveillance, such as through wastewater or the number of emergency department visits, when available, can also inform decision-making as well for health officials and individuals. But these are the primary three indicators that CDC is using to make those best informed decisions around the prevention measures that are being recommended for a given community.